transnational meeting in Leeds, we have been working on how the public administration is interacting with the health system in the co-creation of strategies in the management and also in the delivery of the health services. And we have also been checking which are the tools that are facilitating the involvement of the different actors like patients, volunteers, etc. in the co-creation of these new health services. Regarding Igualada, we do have a quite well integration between the health and the care system, but of course, like the rest of the populations, we still have to face some problems. The cuts on the budgets, problems of the elderly people, and also some chronic illness. That's what we are intending to, in order to give solutions to all of these problems, we are intending to integrate transversal processes in the 4D Health Innovation Simulation Center.
So in Leeds we have world-class companies involved in health. We have a world-class university involved in health and many other universities helping to improve the health system. We have the National Health Service based in Leeds. So we have both decision makers, thinkers and producers at the table. But what we need to do next as a priority is ensure there is citizen engagement with those companies, with the university and with the decision makers in the health service. We need to find new ways of having them engage, and we need to make sure that that engagement happens not just for the short term but for the medium and long term.
The main focus that we will be concentrated on health will be kids and the families at school. So our idea is to involve the kids, the family, the teachers on food, healthy food, nutrition aspects. And let's see, in this activity we will be supported and will work together with the local university and the companies which are in the city with a very high specialization in this sector. So combining all the strengths which are on the field, we think that the health, especially for kids, will be improved in the mid to long term.
In Tartu we have different projects going on in the field of health system, health field in general. And what we are trying to achieve is definitely how to commercialize more the knowledge that we get from the health system and from the universities to make the life of the local citizens better, but also on the other hand offer better jobs and best quality and best environment in the city.
I'm very happy we are Plungė in this project for the cities, and I think it's a good idea and a big problem in our Lithuania and especially in Plungė, because our people don't want to move. They all time are sitting. It is in a time of young people and in old people, so our plan is to make them move. And our Public Health Bureau makes a lot of analysis and data that we have obesity and lack of physical activities. So I think we will improve that with this project.
We started in the municipality of Gelderop, where one neighborhood really has a problem with obesity and also low incomes of people, less sports participation, and so the municipality is looking for what can we do to activate the community and to create more awareness of active and healthy living. We started first with organizing meetings with citizens, but it was really difficult to get them involved and to get them willing to go to these meetings. So then we started a different approach to really engage these communities, and now we're trying to approach them directly, and it's from a social design perspective. And we do interviews on the street and to get the information about what is for them a trigger to be more active, what is important in their neighborhood to do sports or to interrelate and to connect with other citizens in the area. And that's how we collect information about what can make people active.
The challenges in Jena regarding health are that we have to face a demographic problem in future, that we will have less young people, and on the other hand a growing demand of skilled people to go into services to work with elderly and sick people. And therefore the 40 Cities project is a wonderful pushing instrument for us to get aware of the importance of health in Jena, not only the industry part but also the knowledge offers, and to make education and to work in these professions later on more attractive. So we would like to inspire more people to go into health, to work there. And that has a lot to do with get aware how important this sector is and what kind of attractive professions are offered in this sector.
Our plan is very differences from the children information to the elder home care, but we have a lot of things to do. And starting now with to arrange a building for a multifunctional building for different type of healthcare, from prime doctors, medics to the specialists, specialists in surgery, in pediatry and different type of other medical activities. And also in parallel with this we want to construct a social building, a multifunctional social building where the older people can have access, better access to the social health care.
We discussed two very important central issues of the 4D Cities project. One was integration of the health services and the other one was social innovation in health. The integration we discussed and we agreed it is important because it makes more flexible the health services. It helps coordination. It is actually a way of coordinating, but it also responds to the patient individual needs. So addressing integration also means opening a range of new professions in health or in between health and healthcare or social care. In this sense, some of the countries, some of the cities come from countries where they have these intermediate professions, but some others, like it is the case in the UK, they they are experiencing multidisciplinary teams, but they do not have these intermediate professions between health and care. So we could see different backgrounds, different experiences here. So this new approach of health from the social innovation perspective or the citizens' perspective, it was, for some of the cities, was not that easy to understand how to adapt it to its model. Cities that come from a starting point of a very technological innovation, they have to integrate this new approach to complete the 4 helix perspective of the project. Instead, some other cities, like for example Igualada, are more used to this citizens' participation and involvement and engagement approach. Some other cities like Eindhoven have undertaken a very interesting project to involve people from a neighborhood, also to participate and to engage them in health, in healthier lives and healthy activity.
Innovation and new strategies in healthcare are, most of them, focused on technological innovation. So after the meeting, we realized that it's absolutely necessary to consider 2 issues. First of all, the human factor engineering. So all of the human factors that have some influence on the final result when the professionals and the patients and the caregivers are using this new technology. And secondly, and the most important, we must consider the non-techno and particularly the social innovation, which is more and more impact in the final result in the healthcare system.